Hello, everybody. I'm just waiting a minute or two. We're just letting people into the webinar. Right. I think probably most everybody who was in the waiting room is with us now. So I'd like to welcome you to our webinar. And before I go any further, if any of you want captions, closed captions, we do have palantypists, but you will have to link onto them through the chat box, I'm afraid. So you will just, the link is in the chat box. It should have come up. So please go into chat and link on that if you want real-time captions. The captions will be in English. So welcome again. And I know we've got people joining us from all parts of the world, which is really exciting, and it's very warm welcome to you. I'm Joanna Clark. I'm the Director of Deaf Child Worldwide, and some of you may know Deaf Child Worldwide is the international arm of the National Deaf Children Society here in the UK. Today is the first of 5 webinars, which are based on topics in a publication that we launched last December called Unheard Children. Some of you may have been at the launch, or you may have had a chance to look at the publication on our website. The publication itself addresses 5 key topics that really are of major importance for deaf children, particularly in low-income countries, and they talk about the barriers that deaf children and young people face, and also propose some ways in which these can be overcome. Today's topic is language and communication, because basically this is the most fundamental issue facing all deaf children. And in fact, effective language and communication skills are crucial for all children's emotional and intellectual development. But for deaf children, this is achieving fluent language and communication is often one of their greatest challenges. So that's the topic we'll be looking at today. Just before we move on to the main part of the webinar, I'm going to do a few little bits of housekeeping. As you'll see, we will have throughout international sign interpreters who you will see on screen. If you have your own interpreter, you can pin them to your own screen by clicking on the 3 dots on the video, on your interpreter's video. If you have any questions, put it in chat and someone can help you with that, help explain that a bit more. As I mentioned before, we have live captions in English, but you will need to click onto these if you want them through the chat box, and the link is there on the screen. I would ask you all, please, during the main part of the webinar, to switch off your videos and to mute yourselves. Once we come on to the more participatory part of the proceedings, then you'll be in smaller groups and you'll be able to, we'll be encouraging you to see each other. If you have any questions throughout the course of the webinar, please put them in the chat box, and there are different people behind the scenes who will try to deal with different types of question. But we will be asking you also to ask questions of the presenters during and after their presentations. And now we're going to start off with a little bit of participation, because we sent out some information last week with the registration. And just to get things started, get us all thinking about the topic, we're going to ask a couple of quick multiple choice questions to see what your responses are. So please do answer them. That is completely anonymous, so there's absolutely no attribution to any of the answers. So if we can put those up on the screen now, perhaps you can just fill in the box. It should be fairly self-explanatory. We give it a minute to come up on screen. There we go. So the first question is, as a percentage, how many deaf babies do you think are born to hearing families, into hearing families, babies that are born deaf? And then which years of a child's life do you think are the most important for developing language? If you can, it will give you a few seconds to fill those in, and then we'll see the results. Okay, if you can, when you filled it in, just yes, press submit, and we'll give it a couple of seconds. Okay, well, I think judging by the results, you're all very knowledgeable, so that's great, and thank you very much for participating in that. So we're looking at a proposed 77% of children, 77% of respondents are saying that 90% of deaf children are born to hearing families, and 92% of you are saying that the first 3 years are the most important, and I think we would certainly agree with that. So thank you very much. Just before I talk through briefly through the agenda, I do just want to mention how we're defining terms in these discussions. You will hear us refer to deaf children and young people. You'll hear us refer to language when we're speaking generally. And for the purposes of the webinar, when we say deaf, we are referring to children and adults with any level of deafness, so from mild to profound. And when we say language, we mean all language, both sign and spoken. So just for the purposes of this, please be aware of that. And now I'll just briefly go on to the agenda. And obviously we've covered the first bit. We will be having presentations from 2 speakers shortly, and we've got 2 speakers who I'm delighted to say have joined us. They both have an absolute wealth of both personal and professional knowledge of working with deaf children, and really know and understand some of the challenges that children face, especially when they're trying to develop language and communication skills. Once both speakers have presented, we'll have a bit of time for questions and answers from all of you. So I would ask that while they're speaking, as things occur to you, please put the questions in the chat box, and we will try and address as many as we can in the short time that we have. And so we'll collate some of them probably and see how we go from there. Once we've had a bit of a chance for some questions and answers, we'll also have a short session, and you'll all be allocated a group, a breakout group. There will be 4 groups, and when we get closer to the time, I'll explain a little bit more about how that will work. After which there'll be a very short bit of feedback, and we will probably find we've used all our time by then. So I hope you're going to find it an interesting webinar. And again, thank you very much for joining. And I think without further ado, I will now go on to welcome our first keynote speaker, who is Lorraine Wappling. Lorraine is herself a deaf professional with more than 20 years experience of international development. She's particularly worked on improving access for disabled children and adults to health and education, and again, specifically in Africa, Asia, and the Pacific region. And her particular interest is in deaf education. She's just finishing her PhD, looking at the challenges that deaf children in Kenya face when they begin primary school. So without any further ado, I will hand you over to Lorraine. Thank you very much, Lorraine, for joining us.
That's wonderful. Thank you very much. That's a very nice introduction. Okay, we get the slide deck. Is the slide deck going to come up? Not sure how this is working. Can people see the slide deck?
Hi Lorraine, the presentation is being shared. Everybody can see the first slide.
Okay, I can't actually see the slide deck, but that's wonderful. So thanks very much. And thank you for a wonderful introduction. So it's my job to kick off this webinar series, really, which is fantastic. And as Joanna mentioned, we're starting the series with language and communication because of the fundamental importance, really, of developing good language and communication skills. So if we can go to the first slide. So language and communication, basically fundamental to our lives because obviously we're a social species. Communication as a term is actually really broad and it encompasses all the various different ways in which we try to get our thoughts, our ideas, feelings across to other people. So it would include any sort of sounds, gestures, signs, words, symbols, graphics, all of those things would be encompassed by what we call communication. Now, language is a very special form of communication because language is a rules-based system. Typically, language is spoken, but it's also obviously can take manual form as well. So British Sign Language, Kenya Sign Language, or of course it is very often written. What's really important to recognize is that those rules that form the basis of each language are different for each language. And so therefore they need to be learned by everyone. And that's what happens during early infancy and childhood, is that you're kind of learning the rules of the language, the majority of people around you. So language is really, really important for us because it's through language that meanings about things are shared across communities, between peoples, but also across time, of course. So culture is based around language, and so information gets passed from one generation to the next. So it helps to build and sustain our social relationships, our communities, and of course, as individuals, those relationships begin with our immediate caregivers, our immediate family, and then as we start to grow and develop, it sort of broadens out as we start to meet more and more people in our communities. So language is also there to help us share our inner thoughts and feelings and to share our experiences with others. So it's really important. It's also important because it's fundamental to lifelong learning. Of course, obviously through formal education, but it's also, you know, all the way through our lives, we are using language really to learn and continue to learn. So there's a real need for language as we continue to learn and function in our society and in our communities. So it is just so prevalent and obvious. We're just immersed in it the entire time. It's so important that the Convention on the Rights of the Child enshrines access to language very, very specifically because it understands all children have the right to be heard. They have the right to use their own language. It's fundamentally important. So we can go to the next slide, please. Typically developing infants, language acquisition, how we learn language, it's a process that happens without any need for any intervention. It's a completely natural process. The only thing we have to be taught specifically to do very interestingly, of course, is to read and write. And that's because in terms of our own evolutionary development, language has been with us for so long that we don't need to be formally taught. Whereas writing and reading is relatively new. So we do actually have to be formally taught how to read and write. But basically it's a natural process. But that process obviously can be impacted where you have deaf babies who are born into hearing families. So in fact, most deaf babies will have hearing families, as that little quiz at the beginning of the webinar suggested. You know, most deaf babies, around 90% of deaf babies are born into hearing families, and that's typical throughout the world, not in any specific country. But whilst we need to remember that being born into a hearing family can create language learning difficulties, deaf babies do not have any innate problems with learning a language. Okay, so they just have more difficulties learning a language that is spoken rather than visual if they're born into a hearing family. Deaf babies who are born into a signing-rich environment will acquire sign language as easily and as naturally as their hearing counterparts. So the issue is only that in hearing families, deaf babies typically are not surrounded by a language which is accessible to them. So they don't have language role models from whom to learn the rules of the language. And so this is what can lead to some significant delays in the early language development of deaf babies. If we go to the next slide, please. So how does deafness then impact on language development? Well, in many countries where DCD operates, and in the developing world in general, a key barrier to learning language is, or late language development, is a late diagnosis. Many countries lack basic screening programs, so it's often left to families to identify the potential deafness in their children as they start to get a little bit older. So it can mean that children are not presenting for medical assessments, formal sort of hearing assessments, until maybe around the age of 3 or 4, when parents become more suspicious because the language isn't developing. But it can be as late as 6, 7, even later, would not be unusual. So, of course, by that time, some key language milestones will have been missed because there hasn't been any sort of formal diagnosis or support. So alongside that late diagnosis, then often you see there's just simply a lack of intervention programs. So there aren't easy or affordable ways for families to get help in supporting their deaf children to learn language. And, you know, as we know, often parents have no previous experience with deafness, so they simply don't know what to do and how best to support their deaf babies. And then in addition, of course, many countries, they lack affordable hearing technology, from basic hearing aids all the way through to cochlear implants, or any kind of programs for speech and language development or for ongoing support. So all of these together combine to create a significant potential for a language deficit amongst deaf babies and children. So we go to the next slide. So in terms of the implications, the language deficit then has lifelong implications. We do know from data that is available that deaf children routinely seem to underperform in education against their hearing peers. Part of that will be due to the fact that they've missed formative language learning during early childhood. So if we think about the lack of language, it's more than just communication. It also has an impact on the child's ability to form social relationships. And it often leaves them with very limited understanding of the wider world around them. And that has significant implications for them when they start school, because they're not coming into the classroom having had the same level of socialization as their peers. So they won't have the same knowledge of the world, and they may actually find it quite difficult being with other children. Plus, of course, they're unlikely to have developed sufficient first language skills through which to begin the formal learning process that happens once they're at school. In some of my research, I found that teachers are often really unaware and unprepared for how to support young deaf children when they start school. The fundamental need for them to help deaf children develop their first language often is not part of the curriculum, and neither is helping them to socialize and learn about the wider world. So altogether, this kind of lack of recognition of the impact of the language deficit experienced by deaf children means that many education systems actually are failing deaf children rather than deaf children failing education. So we do know that there are things that can be done to improve the situation. So even where contexts are very resource limited, small things can make a difference. So for example, obviously investing in early identification and intervention programs can make a real difference across the life cycle of the deaf person. So affordable, fairly reliable tech is available for screening for deafness in very young children. So it is possible to identify deaf children early. It just needs for governments and health services to recognise the importance of ensuring that that's available. Supporting families to positively include their deaf babies and children in communication also works. So DCW has worked really closely with families, helping them, particularly in the early years, and has seen at firsthand how significant this can be, especially around reducing stigma. So that's really important, trying to ensure that a deaf child is fully integrated into a family. And is not being, marginalized within the family unit is going to help their whole socialization and communication to develop. Early support at this point can build the children's language and self-confidence ready for when they start school. There's no doubt also that access to affordable hearing technology and ongoing support can make a difference for many deaf children, but it mustn't be a one-off thing. It's not simply a one-off intervention where a single piece of technology is given to a family and then there is no follow-up at all. So tech needs to be used in a way which is, not just a one-off provision. Currently, there is not enough equitable access to technology, despite it being available. So governments really need to be encouraged to invest and develop in things like audiology services for deaf children and adults to ensure that across the life cycle, deaf people are able to fulfill their potential. Another intervention which we know works is exposure to rich language. Definitely helps. So language acquisition, as I said, is a natural process, but it needs to be accessible to deaf babies and children. So putting families in touch with deaf role models or people who are native sign language users, for example, can be really enriching for families. And also, if you're linking perhaps deaf role models to early education programs, that again can help to encourage deaf children who haven't been exposed to accessible language to really start to pick up language. And very often, if they're young enough, they'll do that really, really quickly. And of course, the more deaf teachers there are, particularly in early years, the better the language environment and engagement is going to be as well. So finally, I think another intervention which we know works is supporting teachers to gain better skills and to improve generally the quality of teacher training so that teachers, particularly in the early years, are taught how to support first language development amongst young deaf children. That's also going to be making a difference. I'm going to leave it there and thank you very much for listening, and I'm going to hand over to the wonderful Dr. Joyce for her perspective.
Hello, I'm not sure if you can hear me. I hope you can.
Yes, we can hear you.
Yes, okay, it hasn't come up on the screen. Just thank you very much, Lorraine, for your presentation. I mean, there's a huge amount of information and food for thought there, which I'm sure you've all found really extremely helpful. I would ask you, if you have any questions for Lorraine, please do put them in the chat at any time, and we will try and address some of these once we've heard from our next speaker, who is Dr. Joyce Naluye from Uganda, and we're delighted to have Dr. Joyce with us. Her presentation will actually be recorded because we weren't quite sure about the internet connection, but I'm delighted to say that Dr. Joyce is with us here and will be here online to answer any questions after the presentation. Dr. Joyce is a psychiatrist from Uganda, and she leads the National Association of Parents of Deaf Children in Uganda, which she actually founded after her own child was diagnosed as being deaf. And she is a fierce advocate for the deaf community, and she's going to now share some of her experiences of working with families to help them and help improve communication between children and other family members. So over to Dr. Joyce. Thank you.
Child, I have 3 children, and my second born is the one who has profound hearing impairment. So it starts from when I went to the ENT doctor, my doctor, and he assessed the child, gave us the news. We all got stressed, but this doctor was with us and the nursing team. They gave us information, but what surprised me was that they knew about deaf services. So they introduced us to a school for the deaf because, we had questions. How are we going to communicate with this child? Is the child ever going to study? Is she ever going to get married? All those questions were in our hearts. So he led us to the school for the deaf. It is called Uganda School for the Deaf in Ntinda. Now, when I reached there, we went as a family, me, my husband, the siblings, and everybody who was with us. So what we found was that there was a small parent support group which visited the school every Wednesday to learn how to communicate with their deaf children. And there we were really, we went crying, real crying in that grief of loss of this hearing child, the normal child. And sincerely, we were comforted by the parents whom we found there and the children. So I was wondering, how do the other children cope? I'm a doctor, and I was wondering really if I can feel this pain, what is happening to the other parents out there. So as time went by, I kept asking so many questions. I noted that whenever I met a deaf child or any deaf adult, and I asked them, how are you? Are you happy? They always brought up this issue of we deaf children or we deaf people are poor. We deaf people, there was a sign of an inequality among the deaf society. And when I analyzed the situation, I noted that deaf children really get assessed very late in Uganda. That knowledge of awareness of deafness of children, parents would get it very late. So they would start school very late. The other thing which struck me was that children, deaf children or children with hearing impairment, were not staying in schools for longer periods of time. So they were dropping out of school. And all this now led back to parent support, family support. So when I asked around my colleagues who had older children, they told me that, you know what, there used to be a parent support group at national level, which had actually now phased out. We tried to look for this group and we couldn't find, but we could find pockets of parent support groups in certain districts where we really traveled, like wherever we would hear that there's a parent support group here. And what were we looking for? How do we support these children early enough? How can we have the same voice to speak to government, to speak to the policymakers? How can we advocate for these deaf children so that they can access services as early as possible and quality services? At NAPADEP, we mobilize parents to form small parent support groups. And in their groups, they learn how to communicate. They learn more about deafness because it is really big. And they learn how to communicate. In Uganda, it's mainly sign language, but we give advice to the parents to use total communication. In the past, where we are coming from, we heard that when sign language was being promoted, some children who even had some ability to speak were not empowered to speak. So now we encourage parents to speak as much as possible to their children, as well as signing. Yeah. So we promote the total communication. Fortunately or unfortunately, in Uganda, it's really still a challenge accessing technology assistive devices. As I said, we do not have, or we have limited services for early identification. So most children get identified late. And we now have some NGOs which are supporting cochlear implants, but it is still a little bit expensive on the families. So very few families access cochlear implants, but I'm happy that it is coming. It has just started in the earlier years, like maybe 5 years from now. So very few children are accessing cochlear implants. It is a service that is really lacking in our country. When you read about how children get early identification, when or immediately after birth, you wonder, when shall we ever get this service? Of late, I think the average is getting lower, like 3 to 5 years, because now there is more awareness. But where we are coming from, children have been diagnosed even after 12 years. You go for, especially when you move away from the capital city, that is Kampala, as you move down in the villages, there are many children who get diagnosed even after 7 years. But on average, they are diagnosed between 3 to 5 years. Because usually parents get concerned when their children cannot communicate. And in the early years, they are told maybe it is this, maybe it is the other. And also accessibility to audiology services. Some children who stay away from the main cities, part of it is about their belief system, because like some people will think that this is a curse or this is witchcraft. So they spend a lot of time doing other things other than accessing health services. But on average, it is between 3 and 5 years, which is still late.
Thank you very much, Dr. Joyce. That's some really interesting insights into the lives of deaf children in Uganda and some of the challenges that they face with regard to developing language and communication. I think the two really, there's such a lot in both of those presentations, and it's quite a lot almost to take in, but I'd be pleased if anybody has any questions they'd like to put up on the chat. I think we've had quite a few questions or queries about access to resources, which I think says a lot, because I think part of the problem is there are not that many resources around. But I would also encourage any other participants on the webinar, if you do have resources, please do share them. You know, this is not this is an opportunity for those of us who are all working in the similar field and have the same concerns to share some of our knowledge and experience. I think hopefully Lorraine and Dr. Joyce can join us on screen now. I can't see them. There they are. There they are. Hello, both of you. Thank you both very much indeed for really interesting and in-depth discussions. And there's such a lot really we could discuss for hours, I'm sure. I wonder, there is one question I wonder if I could direct to Lorraine first. When you've obviously both of you have talked about early diagnosis and how important that is. I think, of course, the reality is, as we've also heard, is that isn't happening in a lot of countries. So how do we, what can we do to really help those who haven't had an early diagnosis and who perhaps come into any sort of education system quite late? I know if you could just sort of talk a little bit about that. I know there's no easy answer.
Yeah, let's start with the easy questions. Maybe I'll just say a few words, and then I'll also hand over to Dr. Joyce as well for her experiences. But certainly, I mean, I think one of the most important things that we can do is recognize the children's language deficit and try to provide as rich a language as possible. And I think that gets forgotten in the sort of whole need to get through curriculums and get through, make sure that when kids first get into school, there's this whole drive very often to get through, we need to be teaching them to read and write and all of this, without sort of realizing that actually fundamentally many of those children don't have a sufficient first language before starting to talk about, learning how to read and write. So in some ways, I think being able to focus particularly on early education, sort of preschool or the very early grade years, taking the pressure off deaf kids in particular and teachers of deaf children, so that they can at least have some time in more of an immersive, accessible language environment, then that should have a bit of a benefit later on, ensuring that there's just a little bit easier for the kids to be able to start learning to read and write. Dr. Joyce, what would you advise?
Thank you so much. Really, it's not an easy question, but I believe that maybe better late than never. So at any stage, the hands of teachers, they can really go some far, I think. Yeah.
Mm.
Thank you very much, both of you. I think, we have found that in a way, obviously, what we're all advocating for is for the chance for deaf children to get early diagnosis so that they can start to learn early, but the reality is that most of us working with deaf children, particularly in low income settings, are finding that that just isn't the case. So there are, you know, potentially two generations. There are children who have never had an early opportunity to develop language, and then hopefully there are some who are being born now who will get that opportunity. We have a number of other questions coming in that I'm just looking at. So there is a question about secondary education, and I wonder perhaps maybe to start again, perhaps with Lorraine, we've got a question about resources that are available for secondary students. We seem to talk quite a lot about early childhood and primary children, but you know, what happens at secondary level?
Yeah, that's a great question. I mean, it's sort of a, you know, a lot of sort of development focus has been on basic education, so primary education traditionally. So there's been more of a focus on primary education. When it comes to secondary education, many countries have only just gone to sort of either gone to universal secondary education or are working towards universal secondary education, which is brilliant. But when it comes to kids with special needs, deaf kids, for example, again, the whole development community really is way behind where it should be, and that also goes for early years learning too. So there is a, you know, a serious lack of resources at secondary level. What tends to happen, I think, in my experience, is that once any support that's given, particularly in mainstream or in special education, it tends to be focused on primary, because in primary schools you tend to have very few teachers per child. So the child is just getting all of its lessons from one or two teachers. So being able to provide support is often more doable. Once you get to secondary school, of course, you start to broaden out your curriculum. So you start to have, you know, science and maths and English, and, you know, they become much more specialist, and therefore the resources become much more stretched. So it is always really, really tricky once you get to secondary education. And I haven't yet come across a secondary education program where deaf children are being supported in a mainstream context. What tends to happen is deaf children then remain within a special education context. And then, you know, the extent to which they're able to get good science education or you know, humanities education, then, you know, it's much less, you know, it can be more difficult. So it's, I mean, I'm not really answering the question, to be fair, other than to say there's a huge need for, particularly in the development sector, to focus on what's happening to kids with disabilities in these contexts, because, you know, they are genuinely being left behind, I think.
Right. Thank you, Lorraine. Did you want to add anything about secondary education at all, Dr. Joyce?
Yeah, so I must say that beyond all stages to university now, and we've gone through the challenges at all levels. Now, I think I need to say that very few deaf children in Uganda can access secondary education. Most of them drop out of school after very few complete primary 7, because our education system is that we do not have many preschools. So they start in primary, then secondary school. Majority, if they are well supported, they will access vocational skills training. So very few get through to secondary and then maybe university education. So the challenges are really many, and everything goes back to the family here in Uganda. So for primary and secondary education, when a child reaches secondary school, it is basically the parent. If you want your child maybe to be inclusive in an inclusive setting, you have to hire interpreter services, which is very expensive because, yeah, it is the parent, the families to support their children until they reach university level. That is when government will come in to hire.
Thank you very much, Dr. Joyce. I mean, that actually leads us on.
An interpreter at
Sorry.
university. So very few children.
It's a slightly bad connection. Sorry, I thought you'd finished, which is why I jumped in. But I wonder, actually, yeah.
I wanted to say that, yeah.
Yeah, it's a little bit of a bad connection, Dr. Joyce, but from what you were saying, I wonder, there is a bit of a follow-on question here, which, you know, it would be really interesting to hear from you about, and that is, you know, what do you think? I mean, obviously, you've said if families can afford it, they could get an interpreter and so on, but it's expensive, it's out of the reach of a lot of families. So in your experience, particularly working with NAPADEC, for example, what sort of support do you think is the most beneficial that can be offered for parents in those circumstances?
It's a challenging question also, because, you know, everything goes with finances. I think what we can do for the parents is to help them improve their incomes, because most of the parents, they really want to support, but what comes next is that they cannot afford. So we try to help them in their groups to establish like saving schemes, and also to link them to some government projects which can help the of parents. Really, when we talk about poverty, it is real, it is true. Very few parents have incomes which can enable them to support their children. Here in Uganda, it is a bit, the challenge we have is that not every district, for example, will have a school where deaf children can access education. So you find that they have to travel longer distances to access education wherever it is, which means that the parent has to pay for transport, or you have to the best is to put your child in a boarding school, and then you continue visiting them there. So I think is to support the families to improve their incomes in order to support all their children, and also to create awareness, because you find that to some families it is not actually poverty, able to pay for their hearing children, but not these children with disability. Mm-hmm. So there is that other component also of attitude change towards their children with disabilities. Some of them don't know that actually deaf children can become educated and they lead independent lives. Some of them do not know. So the use of role models, deaf role models, has also helped us to create that kind of awareness and attitude change.
Great, thank you very much, Dr. Joyce. I don't know if there's anything you would like to add to that, Lorraine? I know you've done a lot of work with families as well.
Yeah, I think I definitely think the attitude that is really, really important, and I you know what Dr. Joyce said about improving the attitudes is really, really important, because there's often a sense that deaf children, you know, they can't learn, or that, you know, there's not much point in investing in that education because, you know, they're not going to be independent, whereas of course that's definitely not the case. So role models are really important. I think also we need to be putting more pressure on governments to improve the services. You know, and that goes from early identification to, you know, better teacher training, better schools. We need more schools that are accessible closer to home. So I think there needs to be more of a accountability on the part of governments too, to, you know, and we can all play a role in that, I think, in making more demands on governments, because it's an investment. You know, governments are investing in the future of you know, deaf children and young people, and you know, it's going to be worth it because of the payback later on in life. So I think we do need to be putting more pressure on governments and development programs to be inclusive and to make these services available, rather than putting all of the pressure on families. You know.
Thank you. I mean, I'm just looking, sorry to interrupt, I'm just looking at some of the comments coming up that I know you can all see. I think there's some really interesting discussion points here, and some of them I hope you'll be able to talk a bit more about when we go into breakout groups. And you know, there's an interesting point about, is there, do children and young people have a right to an interpreter? And I think the whole business of, you know, rights and what is actually delivered is a huge one. I don't know if anybody would like to comment on that, and perhaps to also think another question here, particularly in light of you know, experiences during the pandemic over the last year. Would sort of remote learning support, is there a role for remote learning support to be available through phones or apps to help secondary school children, or help children get into secondary school? Dr. Joyce, do you have any thoughts on that? I don't know if you've been using any sort of internet technology or remote learning during the last year.
Yeah. Yes, as I said, you know, COVID also came with its own challenges. For children, what I noticed here is that for children who had been using these technologies, it was a little easier. Like for secondary educators could have, yeah. But we noted that many children didn't know how to use these technologies because they had not been using them even before COVID. Now, the other challenge we had here in Uganda was that most of the teaching during COVID was on radio and television, which meant that the family had to have someone, or they are the family member. Now, most families, they don't have such people who have been lucky to have this education. Even me, myself, I couldn't teach my daughter because you had to go back to the textbook and, yeah. But for all the children, they can read for themselves. I remember we would materials and then give to this deaf understand the materials, translate them into the local language to see if the parents can communicate with their deaf children. But it was really, it is still a great challenge because children are still at home.
Yeah.
Have older siblings, they can help in a way, but sincerely use of technology, it can help, but it also means that we have to go back to school because most schools don't have
Yeah.
to this
I think your connection is not too good, Dr. Joyce. I'm really sorry it keeps breaking up, but I think we definitely got most of what you said. And, you know, it's a real challenge because technology, of course, could help, but people have to have access to it and have to be able to understand it in the first place. I think, did you have anything to say at all on that, Lorraine, as well? And then I think I'll have to close this session because we need to move on to the breakout sessions. But if you had any quick word on technology at all, Lorraine?
Yeah, definitely. I mean, I think technology is going to be more significant, and in some ways what we can get from the pandemic, you know, there has been a much more of a focus on how to get online resources available. Unfortunately, that hasn't necessarily included disabled kids in general. There definitely, I think there are some really exciting programs that are happening where sign language is being added to, like Ekitabu, for example, who are adding sign language to early readers for use in the classroom. So I think definitely in tech is going to become an important resource. But I think often with this kind of tech, on its own, it doesn't solve the problem, but it can become part of a solution if it's used in a way which is, you know, teachers understand, the kids understand, they become used to it. Then I think tech is going to definitely make a massive difference. But I think it needs to be introduced in a way which is holistic. So it's not just seen as the solution, but it's seen as part of a whole package of interventions working together. And then I see a really promising future, I think, for tech.
Right, thank you very much. And thank you both Lorraine and Dr. Joyce for answering some quite challenging questions, or at least discussing them. And thank you for everybody for all there's quite a lot of information coming up on chat. So if you're not looking at it, so, you know, the whole purpose of this webinar is that we can share information. And thank you all for participating in that and interacting and sending through links, and we'll try and you know, keep note of those so that we can share them more widely as well. But I do encourage everyone to have a look and see what people are saying. And I do apologize if we haven't managed to cover every question, but thank you so much for all your sort of contributions. We do now have an opportunity, just a short opportunity, and we're going to put you all into breakout rooms, and hopefully some of the points that perhaps didn't get covered in the Q&As you can raise in the groups. You'll see a notification on your screen in a minute asking you to click join, and you'll move into a room. There will be a facilitator for each of the groups who will explain anything else you need to know when you get there. You'll be there for around about 10 to 15 minutes, no more, and then there'll be a very brief feedback after that. So I do hope you find this an opportunity to you know, be able to raise some things more directly yourselves. So I don't think I need to give you any more information. So I think we can put you all into your different breakout rooms now, and I look forward to seeing you again in about 10 or 15 minutes. Hello, welcome back, everybody. I think probably everyone's back now from the breakout rooms. I hope you've had an opportunity to have, a bit more of an interactive discussion. Again, short timing, but it's surprising what we can say in quite a short time. I'm going to now invite each of the group facilitators to just feedback with a couple of, sorry, I just saw a note come up, with a couple of key points from the discussion, if you would, so that we can just hear a little bit about what some of the core topics were. So could I invite Al, please, to feedback first? Thank you.
Can I just check that you can hear me?
Yes, can hear you. Can't see you at the moment.
Right, okay. I had a few technology problems, so which has been one of the themes, I guess. So Lorraine very kindly chaired most of the session, but the points I picked up were really around early diagnosis and how it's especially beneficial if there can be a link between education and health services, and that would be very empowering for parents. And the point that was made was that many, until the moment that they recognize that they have a deaf child, many parents have never before met a deaf person, and now they've got a deaf child to look after, and they need a massive support to actually build up their confidence to be able to cope with that situation. And then the other final point that I wanted to mention is that one of the group said that the rich language environment that we've been talking about is beneficial for all children, whether hearing or deaf. So those are the 2 points I'd like to put across.
That's great. Thank you very much, Al. I'm going to move on straight away to the next group. And could I ask Karina to give a little bit of feedback from that group? If you can come up on the screen, that would be great, Karina.
Yes, I think my video is on, and you're lucky because my internet just dropped out, but I'm back. So I am going to try and summarize. So we had two main points. So we had Nancy from Luga Ishara, I hope I'm pronouncing that correctly, telling us a little bit more about how they have a language and communication center and how they're making Kenyan Sign Language, teaching Kenyan Sign Language more child friendly using technology. So they use cartoons and animations to do that. But an interesting point I think that was there was that they also use a very holistic approach, and that they provide a lot of support to parents after they have heard about the diagnosis of their child's hearing impairment. So working also in the early intervention phase of it as well, and that it can't just be left up to technology, but that it's certainly very helpful to have it there. And also an important point about they also held a competition to get people involved in learning sign language, and that they had an assumption that parents really wouldn't be that interested, but actually they had more sign-ups than they expected, again making that point that parents and families, working with families, is extremely important. And that certainly fed through in another key point where we had Linda, who I think you're from Isle of Man, I'm sorry if I've got that wrong, but from a UK perspective works in the sensory support service in mainstream schools, and is worried about a particular child that she cares for currently in COVID, where there's lots of technology, but there's not as much input from his family, and just how interesting that is in comparison to the lower middle income countries that we work in, where our emphasis is very much on the families, where we don't have those sort of that intensive support at schools. And just the emphasis, I think, really is that working with families is extremely important, really. So I hope I've been able to summarize our conversation there, but it was very, very interesting. So thanks to all involved.
Thank you very much, Karina, and to that group. And could I ask Shampa now perhaps to come and feedback from?
Yes, so the very first point in our group was that technology can be a huge support, even if it's in the form of simple resources. And the example was given of even resources in this country that have been used, like some speech and language apps, which use pictures along with sign language and some voice support as well. Maybe they can be adapted and used in low-income countries as well. And then there are also very simple practical solutions, like if you're explaining, say, the concept of tree, you use practical solutions, or such as maybe taking the children out to look at trees and then explain the concept through that method as well. The second point was about where the example was given of Guyana, where there is very limited understanding of deafness as amongst deaf people themselves and the wider community, and that acts as a major barrier to addressing deafness. So one of the solutions potentially could be understanding, increasing the awareness of deafness in the communities. Lack of understanding of deafness also results in delayed diagnosis. So again, that would then help address some of the points that were made in our presentations earlier today about, identification of deafness and addressing deafness, developing language in the early years. And then the third point we had was about low resource settings where people cannot afford diagnosis and treatment. In some countries, for example, in India, there is government support provided on these kinds of things. Of course, there is the challenge where the quality of such support or the number, the manpower isn't enough to be addressing these, to provide the kind of support that is required, but that needs addressing, pushing it with the government to make it worthwhile or of the right quality. Thank you.
Right, thank you very much, Shampa. And the last group, if Juliet could feedback, please, that would be great.
Yeah, certainly. Thank you very much. Yes, we began and ended by talking about teachers of the deaf, and we started by talking about there needing to be specialist intervention, and we kind of ended on a note of needing to raise the profile of teachers of the deaf, making sure that they are specialists, that they have got the right training, and building up their experience, making sure that they are adequately qualified and able to work in that way. And one of our other main points, we were joined by Harriet, who has worked with Dr. Joyce, talking about the need for use of parents groups, making sure that parents groups are really strong, and that parents who learn about working with their deaf child, having learned sign language, not only sort of work with their own child, but then also take part and take on some responsibility and role in working within a community to teach other children, to bring other deaf children sort of in and use their experience from that way. Making sure that those early intervention efforts cut across urban as well as rural areas, using sign language applications where they need to. We touched on technology as part of the solution, but as we've all said, partially something that is there's a major barrier in many of the spaces that we work in. So I think that was our contribution.
That's great. Thank you very much. And really the excellent sort of feedback. It sounds as if you've all had some really rich discussion, and I would like to thank everybody for sort of engaging in that and really, staying on for those conversations. There've been one or two questions about whether or not this is all going to be recorded. The bulk, the presentations and the general, all the discussion in the general forum has been recorded, and it will be available on YouTube in a couple of days' time. Your discussions in the groups were recorded, but just for the purposes of us being able to take perhaps some notes, those will not go out on YouTube. So it's just the main bulk of the session. So some people are asking if the slides will be shared. I think to begin with, we'll be putting them up on YouTube, and then we will see what else we can put together for you. We will do a roundup of all the resources and the links that those of you that have sent us links through chat. We'll do a roundup of those, and there'll be a note coming out to you tomorrow with those resources, with links, and telling you about the next webinars, which I will just mention now, because interesting to hear that, and interesting but not surprising to hear that a lot of the discussions were around the role of families. And in fact, our next webinar, which will be on the 11th of May, will focus on specifically the sort of role of families. And we'll have some really interesting presentations from South Asia, and also with some experiences from South America for that webinar as well. So I do hope you can join us. The webinar after that will be on communities as well, which of course is another big area that has been touched on, and that will be on the 22nd of June. There'll be 2 further webinars after that for which we don't have dates, and those will be on education and on independence. So I would really look forward to sort of engaging more with a lot of you in conversations. We'd love to be able to collaborate with some of you and perhaps start some discussions about that. And I would also just like to highlight the fact that we do now have a training program which we've developed. And so if you do work with deaf children and young people and their families, or if you're thinking of starting work with them, please do have a look at our website and see what's sort of on offer there, or email us at the address that's coming up on the screen now. We do have both deaf and hearing trainers, and all our training is sort of available and accessible to deaf participants. And we certainly obviously encourage that. So if I think we're coming right up to the end of our time, so it just leaves me with the opportunity to thank you all again. Thank you very much to our 2 speakers, Lorraine and Dr. Joyce. Thank you to all of you for really sort of engaging in the discussion and engaging in the groups. It's been lovely to make contact with you all, and hope to see you again soon.
Yeah.